How y'all doing today? I'm a radiologist working here in Central Illinois the last 12 years. I grew up in a big Catholic family. I listened to National Public Radio, and I was a liberal. In my first election, I voted against Ronald Reagan. It is said that a young man who isn't a liberal doesn't have a heart. It's also said that an old man who isn't a conservative doesn't have a brain. Writing this essay, I literally became sick to my stomach. Was I afraid my job might go away? No. I'm going to have job security. If Massachusetts is an example, we're going to need a lot more doctors because there'll be fewer and fewer people that want to do that job. Will I lose income? Actually, my income will probably go up because I'll be getting payments for people who previously paid me nothing. So why am I afraid? I believe that the Patient Protection and Affordable Care Act of 2010, Obamacare, will destroy the best healthcare system the world has ever known. I believe this destruction of private healthcare is an intentional act which will lead to a lifetime of dependence on the government. In lobbying for healthcare reform, President Obama, the Democratic Congress, and the media told us there was a healthcare crisis in America. It was an emergency. There was no time to think about it. 48 million people had no insurance. Lives were in the balance. Insurance companies were letting people die to make a profit. The cost of healthcare was unsustainable. The Democratic healthcare plan was the answer. It was over 2,000 pages long. Nobody had read it, but it had to be passed now. Nancy Pelosi, the Speaker of the House, said, "We have to pass this bill so that you can find out what's in it." It's now 6 months later, and we're starting to find out. Obamacare will adversely affect your God-given rights enumerated in the Declaration of Independence, your right to life, liberty, and the pursuit of happiness. How will this affect your life? The Affordable Health Care Act empowers a bureaucracy to make decisions about what types of treatments and tests to pay for. The people in charge of these councils and committees will not be answerable to you. Who's on these councils? Donald Berwick, the person who has been chosen to implement healthcare reform, is so radical that to avoid a Senate confirmation hearing, Obama made a recess appointment, even though the Democrats have a filibuster-proof majority. Berwick has condemned the free market. He has declared the United States should be more like Britain. He's criticized consumers in the US, that's you, because you want to get the care that you deserve rather than what you need. He has stated he wants to fix this problem, because that's what leaders do. Dr. Ezekiel Emanuel, Zeke, Rahm Emanuel's brother, is an advisor to the President of Healthcare. He has published a plan, you can read it, it's in the Lancet, it's on the internet. It's called the Complete Life System. This system is for rationing healthcare. It's a very thoughtful and logical plan. But the heart of the proposal is that some lives are worth more than others. If you are under about 15 years old, he says that society hasn't invested very much in you, and so you are expendable. After 40 or so, you start consuming more resources than you produce, and you're not worth the effort. Already, there are several of these councils which are putting out information and recommendations. One in particular is about procedures like mammograms. They claim that mammograms aren't really effective because they only work about 20 to 40%, they only save about 20 to 40% of women's lives. And you have to screen everyone, so it's not cost effective. Interestingly, the target age for mammograms is women over 40. In my own literature, I'm starting to see editorials which suggest that radiologists shouldn't really look too hard at some studies, particularly older patients, because, well, it's not really going to help anything for them anyway. So, will Obamacare affect your liberty? First of all, your healthcare choices will be limited. The administration has estimated that over half of you who have insurance now will have to get a new plan, and that plan will be more expensive. 7 million seniors who belong to the Medicare Advantage program will probably not be able to stay in that program because of cuts. Some companies, including my own healthcare company, are totally dropping out of the business. Obamacare requires that small businesses report any purchase of more than $600 in a year to the Internal Revenue Service. I'm not sure why that's in the healthcare bill. If you choose not to participate, that's freedom of choice, the IRS may confiscate all or part of your tax refund. And to make sure you do follow that, they're planning on hiring 16,000 new agents to make sure. The law allows the collection of personal information to feed back to many different government departments to determine who's getting health care and why. If you think they won't use that information, you should have listened yesterday to the Civil Rights Commission hearing, where a Department of Justice lawyer, the head of the voting section, testified that it's currently the Obama administration's policy to make decisions about who to prosecute for voting crimes based solely on race. Will this affect your pursuit of happiness? To meet affordable care mandates, most insurance programs will have to raise rates. Most large companies lost tax advantages and have to increase the premiums for workers. Healthcare spending overall for Obamacare will exceed inflation rate or expected growth in the economy. The calculations today are that the cost of providing health care per person will go up significantly for everyone. If you have a business that employs seasonal workers, you'll have to buy them health insurance or not hire them at all. The latest estimate is that the new health care law will cost at least $1 trillion over the next 10 years, with $330 billion added to the deficit and $700 billion in new taxes. These numbers will only get worse because the economy is not improving and there are more and more people living in poverty. So, after 6 months, does Obamacare do what it was promised us it would do? Nope. It's estimated that by 2019, the last year that the act is to be implemented, there will still be 21 million people uninsured. The law actually makes it easier and more cost-effective for employers to provide no health care at all. New mandates have made it costly to insure children individually, and companies are dropping child-only plans. Estimates are that costs will increase faster under the Affordable Care Act than under the previous system. If the president had truly wanted to reduce costs, they would not have cut deals with big pharmaceutical companies or the large healthcare providers. They would have implemented tort reform. A survey taken recently in Illinois shows that over 90% of Illinois doctors have admitted to ordering extra unnecessary tests to try and avoid litigation. Some estimates claim that with the money that Obama is spending, he could have simply bought everyone who was uninsured a private insurance policy. So, why the big rush to have health care reform? I truly believe there are people who want health care reform who believe they're doing good. But the purpose of this health care plan is not to improve health care, but to redistribute wealth, indenture people to the state, and create a permanent ruling class. How do I know this? Well, let's go back to Mr. Berwick. He's been very helpful. He's the head of Obamacare. He said, any healthcare funding plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poor and less fortunate. Excellent healthcare is by definition redistributional. If the Patient Protection and Affordable Care Act is not repealed, you will not have the health care you have now. The cost of medical insurance will continue to increase. Over time, the quality of the healthcare system will decline, just as it has in every country where this system has been tried. We need to send representatives to Washington who will listen to the people, who will take the time to create true reform, who will pass a new health care bill which improves the delivery of health care without creating a monstrous bureaucracy, enslaving workers, or burying our children in debt. Thank you.